an effusion joint fluid.
This one?
No, right
Oh, that
here.
one? Oh, by the,
Right there.
by the quad.
Yeah. So when you relax your patella, you can see that there's this nice little dent right there.
Okay.
So in the sweep test, what I'm going to do, I'm going to take my hand and I'm going to sweep that fluid out of the medial gutter. That's what that is. That's called the medial gutter. And I'm going to push the fluid into the suprapatellar pouch and into the lateral gutter, because this is all one continuous thing. Once I've done that, I'm going to compress the lateral gutter, and if there's a pretty big amount of fluid, you'll see it come rushing right across, and you'll see this fill up with fluid. If there's a tiny amount, I'm going to keep it compressed with my thumb, and I'm just going to bring my fingers across the suprapatellar pouch and watch for a fluid wave right through there. So that's called a sweep test, because I'm going to sweep it all out.
Okay.
Okay? That's the first one. Now, if you've got a kid with a huge effusion, you're not going to necessarily see that sweep, or a chubby kid with a really thick soft tissue envelope, you may not be able to see that. And in that situation, and I want you guys to all do this, put an index and thumb right on the patella and move back 1 centimeter, so you're just sitting on the retinaculum. Now you can feel, I'm not squeezing, my fingers are just sitting there. I am going to compress the suprapatellar pouch, and I use my thumb to kind of keep fluid from going into the lateral gutter. I want it to go really into the medial gutter, so I'm going to just compress, and what I'm feeling for is my fingers to be pushed out by the fluid. And you try this, because you'll go, oh man, that does work.
That's the one I've been taught.
Yeah,
That's the
but
one I've been
what ends up
yeah.
what I see people do a lot of is they squeeze really hard here, and they're going like this,
Yeah.
and you're like, I don't know how you're telling anything
Right.
from that. So you press your fingers in just enough so that the soft tissue, any fat they have, is kind of not pushing on your fingers, so that your fingers are kind of on the retinaculum.
Okay.
And then you just compress. So we're not going down like this. All I'm doing is pushing back. Yeah, and so what you want to do is use this to trap the fluid and keep it from getting out that way. And
Got it.
relax these fingers. We're
Okay.
just setting them there to feel.
Okay.
Because you have to be able to feel the.
You've got to be able to feel
Feel
it push
And
out.
this is the thing that you're keeping.
Yeah.
Okay. Yeah, I see what you're saying. Okay.
So go ahead and give that one. And